study before coming and teaching you. I just come here and do my thing and walk away. So I'm going to teach you the clinical applications of enzymes, and that's what you need to know. Clearly? Yeah, because I have survived knowing this. You should be fine too. Good. Let's start with the favorite enzyme, troponin. Troponin, you've got three different types: troponin I, troponin T, troponin C. What is the role of troponin within the body? I'm sure you know this, but I'm just going to run through it quickly. So that's troponin, and it's got the three components: C, T, and I. Troponin C binds, the function of troponin C is binding to calcium. Troponin T is covering tropomyosin, and tropomyosin in turn is hiding, sort of, it's kind of covering up myosin filament. You've heard of myosin actin?
Yeah.
That's very good. That is so impressive. Troponin I is sort of covering up actin filament. So you've got troponin, three components to it: troponin T, troponin C, and troponin I. Troponin I kind of sort of covers actin filament. Troponin T covers up tropomyosin, which in turn sort of inhibits myosin filament. So when in a normal relaxed state, when your muscles are not contracting, when there is no contraction, can I say calcium is within the sarcoplasmic reticulum?
Yeah.
Yep, calcium is hidden within the sarcoplasmic reticulum. At that time, the actin and the myosin filament are not attached together, they're not interlinking together. And what is preventing that linkage? It's the troponin, which is preventing the linkage. Clear?
Yeah.
Now, when calcium comes in, you want to contract a muscle, there is going to be release of calcium from the sarcoplasmic reticulum. Calcium is going to come in, bind with troponin C. This binding of calcium with troponin C is in turn going to activate troponin T and troponin I. Okay, when I say activate, what I mean, they are going to start separating, they are going to start getting actin and myosin filaments together, and there will be ultimately muscle contraction. There will ultimately be muscle contraction. Everybody understands this? Yes, I can. Binding of calcium with troponin C ultimately results in activation of troponin T and troponin I. And that will cause uncovering of the actin and myosin filaments, and they will come together and bind together. Does that make sense? Yeah? Where is troponin present? Troponin is present in your skeletal muscles and cardiac muscle.
Troponin.
Yeah. Troponin is present in skeletal and cardiac muscles, so there's an MCQ right there. Smooth muscles do not have troponin. Another thing to understand is of troponin I, T, and C, which one is more specific for cardiac muscle? Troponin I and troponin T. Troponin I and troponin T are more specific for cardiac muscle.
What does it mean?
Which means every time you want to check if somebody is having a heart attack, we don't call it heart attack anymore, we call it myocardial infarction. You're going to measure troponin I and troponin T. Let's discuss causes of elevated troponin. Can I say troponin is within the cell? So anything is
Muscle atrophy?
muscular atrophy. Good point, but I would like to raise an objection to that very soon. Okay. Now, every time, can I say troponin? Hello. Hello. No, that's okay. I'm early today. Every time troponin I and every time I said troponin I and troponin T are within the cell, so every time a cell lyses or undergoes cell death, there is going to be release of troponin outside. Does that make sense? Yes? And when it is released from inside the cell outside into your plasma, there's going to be elevated troponin levels.
Can you just say that one more time, please? Troponin is outside the cell.
Troponin is inside the
It's
cell.
inside.
Every time the cell undergoes death, cell death is nothing but infarction. Every time cell death or infarction happens, there is going to be release of troponin outside the cell, which means plasma levels of troponin will increase.
Right.
What are the causes of elevated troponin? I like to club them into cardiac causes and non-cardiac causes. Cardiac causes would be myocardial infarction. Have you started on cardiac module?
No.
Myocardial infarction. Cardiac cause. Another cardiac cause? Anybody? Heart failure.
Why does the heart fail, and why is it different from myocardial infarction?
Oh. It's going to take 2 hours for me to explain
Okay.
that. Why don't you wait till cardio module to answer? Because I will, if I say 2 lines, it's going to be an incomplete explanation, and that's not good for me.
Okay.
Okay. So myocardial infarction, heart failure, and then you have myocarditis, which is just inflammation of the myocardial cell. That could happen as a result of viruses, bacteria. Pericarditis, which is inflammation of the pericardium. Infiltrative cardiac disorders. Infiltrative disorders like, have you heard of these terms? Amyloidosis. Oh, you heard that.
Yeah. Isn't it true?
Sarcoidosis. Hemochromatosis. Myeloidosis, sarcoidosis, hemochromatosis, all these are cardiac causes of elevated troponin. Okay? Non-cardiac causes of elevated troponin, pulmonary embolism. And do you understand the difference between thrombus and embolus? No? Sweetheart, you understand the difference. Can you tell me, please?
Thrombosis is like more of a local clot, whereas embolus triggers up.
Beautiful. Everybody look up here. Now, these are my 2 blood vessels, okay? Let's say this is my renal blood vessel and this is my cerebral blood vessel. Thrombosis is when there is atherosclerosis is the most common cause of thrombosis. The atherosclerotic plaque starts developing within the renal artery. Yes? So that's, I'll call it a renal artery thrombus. When this thrombus gets dislodged, when this atherosclerotic plaque or atherosclerotic thrombus gets dislodged from the renal arteries and goes into my cerebral artery and blocks it, I'll call it an embolus. Does that make sense?
So everywhere
Except the origin
except the origin
Yeah.
is a thrombosis.
is embolus. So thrombus is if the site where the clot starts developing, that's thrombus. When that clot gets dislodged from the original site where it was formed and goes and blocks some other artery, we call it an embolus. Do you understand this?
What would cause it to detach? Is it just?
It's just massive blood. See, if you've got the thrombus, can I say it's obstructing your blood vessel, reducing the lumen? So